Welcome to the fourth and final video in the series, Management of Patients with Chronic Conditions, Medicare's Coverage of Diabetes Care Within the Wellness Visit. This presentation is designed to support healthcare workers in understanding medical nutrition therapy. This series was originally hosted by Superior Health Quality Alliance and presented by National Government Services in January 2023. The objective of the presentation is to learn the services, eligibility, and coverage of medical nutrition therapy for Medicare beneficiaries.
And on this slide that you're seeing before you, it's our disclaimer that says basically we are a contractor of the federal government, and we get our information from CMS, which is the Centers for Medicare and Medicaid Services. And we rely also on Congress and Health and Human Services to determine law and regulations. And as a Medicare administrative contractor, which Kathy will go in more, we implement those laws and regulations as such. So the next section, we will go over MNT, medical nutrition therapy. Just a background, nutrition-related health conditions are prevalent within the Medicare population. 28% of Medicare beneficiaries have diabetes, and 50% have chronic kidney disease. Adult obesity is associated with a number of serious health conditions, including heart disease, hypertension, diabetes, and some cancers. Registered dietitian and nutrition professionals are key providers of nutrition services. They can play a critical role in helping Medicare patients improve their health and prevent and manage many health chronic conditions. Next slide, please. MNT services. The MNT benefit is completely separate benefit from the DSMT benefit. For the purpose of disease management, covered MNT services include the following: an initial nutrition and lifestyle assessment, one-on-one nutritional counseling, information regarding diet management, follow-up sessions to monitor progress. Next slide talks about eligibility. In order for this preventative service period to be covered, the beneficiary must have diabetes, renal disease, or has received a kidney transplant within the last 36 months. MNT services are not covered for beneficiaries who receive maintenance status, for which payment is paid separately in the Social Security Act, Section 1881. A physician must provide a referral and an indicated diagnosis of diabetes or renal disease. Non-physician practitioners cannot make referrals for this service. Next slide, please. MNT coverage. The benefit provides 3 hours of one-on-one MNT services for the first year and 2 hours of coverage each year for subsequent years. No initial hours can be carried over to the next calendar year. Based on medical necessity, additional hours may be covered if a physician orders additional hours of MNT based on a change in the medical condition, diagnosis, or treatment regimen. The number of hours covered in an episode of care may not be exceeded unless a second referral is received from a physician. MNT services may be provided either on an individual or group basis without restriction. You can utilize our call center, what's called the IVR, to determine MNT eligibility information, including an initial date and minutes remaining for initial or follow-up training. Eligibility information is based on the date you call. Here's an example of MNT hours usage. We have an example of how the MNT hours work. It's per calendar year. Medicare covers 3 hours of MNT in a beneficiary's initial calendar year. No initial hours can be carried over to the next calendar year. So here's our hypothetical. If a physician gives a referral to a beneficiary for 3 hours of MNT, but let's say the beneficiary only uses 2 hours in November and nothing more, the calendar year ends in December, so the third hour is not used. It cannot be carried over to the following year. However, the following year, the beneficiary is eligible for 2 follow-up hours with a physician referral. Every subsequent calendar year, a beneficiary must have a new referral for those 2 follow-up hours. I wanted to give you the billing codes that are available for MNT. 9702 is used to be used only for the initial assessment of the patient. Code 97803 is to be billed for the individual reassessment and all interventions after the initial visit. This code should also be used when there is change in the patient's medical condition that affects the nutritional status of the patient. 9704 is used for all subsequent groups visits, and this code can also be used when there is a change in the patient's condition that affects the nutritional status of the patient and the patient is attending in a group. These codes can be paid as submitted by a registered dietitian or a nutrition professional who meet the previously specified requirements, or a hospital that has received reassigned benefits from a registered dietitian or nutritionist. These services cannot be paid institute physician services.
Thank you for listening to this session. We hope you'll join us for the other 3 videos in the series, which are Understand the National Government Services Role as a CMS Administrator and Educational and Self-Service Resources. Second, Medicare's Annual Wellness Visit. And the third, Diabetes Self-Management Training.